I'm Lonnie Lassiter. This is about your health, your business, your relationships, and your life. Get ready. Let's get started. Hey, today we're talking about prevention in the non-pregnant adult. Let's get started. So we're talking about prevention in the non-pregnant adult as recommended by the United States Preventive Services Task Force, or USPSTF. They have different grades of recommendation, A, B, C, and D. A just means absolutely helps, do it. B, probably helps, we think you should probably do it. C means there's evidence to suggest it may, but we're not sure. Definitely want to do it based on individual need. And D is don't do it. So with women's issues, screening for breast cancer using mammogram every year, starting at age 40 to 74. There's also an argument for every 2 years. I tend to do it every year. And then screening for cervical cancer with a pap smear starting at age 21 or when sexually active if that's earlier than that, and until about age 65. And every 2 to 3 years is recommendation. This needs to be individualized based on risk and history. Immunizations, tetanus shot every 10 years starting at age 20. Pneumonia shot starting at age 65 or with risk factors like diabetes. This is a pneumonia shot, protects against the common type of pneumonia people get as they age. And a flu shot. Now, many people opt out of this, but it does show improved outcomes with decreased morbidity and mortality related to influenza, especially in high-risk populations and the elderly. Tobacco, everybody knows the need to not smoke. There are different ways you can quit: cold turkey, nicotine replacement with gum or patches, or vaping has become popular recently. Bupropion and Chantix are medications that you can use to improve your success rate, but ultimately stopping smoking is a very important part of prevention. Hypertension, screening this annually, starting at age 20, but really starting in younger populations too. The goal is 139/89 or less. Pre-hypertension is a thing. If you're close to those numbers but not over them, 135/85 or higher, you have pre-hypertension and need to be very much concerned and on it. But ultimately, starting therapy at 139/89 or above is what we do in practice. There's nuance around different ages, but this is a general guideline. Gastrointestinal cancer, so colon cancer, colonoscopy starting at age 50 and getting that done every 10 years. If people have a big family history or risk factors, then starting colonoscopies at age 40 and repeating every 10 years. Obesity, a body mass index of 26 puts you at no increased risk related to your weight. Overweight technically is 26 to 29.9, and obese is technically over 30. We all should be shooting for 26. And even the people who have different builds, people who call themselves big boned, still need to shoot for a body mass index of 26 if you're thinking about risk related to weight. Dyslipidemia, this is high cholesterol. Cholesterol screening starting at age 20 and even younger in some populations, checking it every 3 years. I tend to do it every year on the lab panel that we draw as part of the annual physical because it's not expensive and easy to do, but certainly every 3 years if everything else is normal. Other screening tests that are not category A but have really standard of practice and are category B for the most part: a prostate-specific antigen, PSA, prostate screening for every man starting at age 50, lung cancer screening in smokers starting at age 55 with a CAT scan of their chest, a bone density scan screening for osteoporosis in women, starting at age 60 or 65, depending on risk factors. Your provider will give you more instruction. Abdominal aneurysm screening with an ultrasound is easy and non-invasive and recommended in smokers starting at age 65, even if you had a history of smoking. Depression screening is good. Fall prevention in the elderly. Sexually transmitted disease screening in women who are sexually active starting at age 24 or younger when they become sexually active. And skin cancer screening, watching moles, checking for size, shape, and color changes. Moles that have multiple colors or irregular borders or getting dark or any kind of unusual characteristics need to be screened with biopsy and monitored closely. That's the high line view of screening and prevention and USPSTF Category A prevention. You should follow up with your primary care provider to discuss this further. I'm happy to send you a handout about prevention. Just go to prevention at .lonnielaster.com for access to that. I'll be happy to email that over to you. Thanks so much. See you soon.